During compression, there are some defects in the tablets. So capping is one of those defects. So you will learn about the capping defect. Capping in the context of tablet manufacturing refers to a defect in which the upper or lower part of a tablet separates from the main body, creating a cap-like appearance. Some common causes of capping include: number 1, inadequate binder content. The binder in the tablet formulation plays a crucial role in holding the granules together. If the binder content is insufficient, it may lead to poor tablet integrity and capping. Number 2, excessive compression force. Applying too much pressure during tablet compression can cause the tablet to split or cap. It's essential to optimize the compression force to ensure proper tablet formation without compromising structural integrity. Number 3, inadequate granule flow property. The flow properties of granules influence their ability to compact uniformly during the compression process. Poor flow properties can result in uneven tablet formation and lead to capping. Number 4, inconsistent granule size. A uniform granule size is essential for homogeneous tablet compression. Variations in granule size can lead to uneven tablet surfaces and contribute to capping. Number 5, moisture content. Excessive moisture in the granules or the compression environment can affect tablet stability. Moisture can cause the granules to stick together, leading to capping. Number 6, inadequate dwell time. The dwell time is the duration for which the compression force is applied. Inadequate or excessive dwell time can impact tablet compression and result in capping. Number 7, tooling issues. Worn or damaged punches and dies can affect the tablet's quality. Regular maintenance of tablet compression tooling is crucial to prevent defects like capping. Conclusion: to address capping issues, pharmaceutical manufacturers, when conduct formulation and for process optimization studies, adjusting the formulation, modifying compression parameters, and ensuring proper equipment maintenance are key strategies to minimize tablet defects, including capping. Quality control measures such as tablet hardness and friability testing are also employed to monitor and maintain tablet quality throughout production. If you like this video, please share and subscribe it. Thanks.